have a seat here. Okay, before we take off the blindfold, we have to ask you some questions. You are at the hospital, but you're in a back room. Actually, back door, I should say. Back door. We go back door. You can say back room too, but we go back door. Back door. Back room. Yeah, I forgot which one it is. Okay. Yeah. You take no insurance. Alright? Cash only. Let me see. Okay, you have paid. I'm taking off the blindfold right now. Yes, I am a medical doctor. I can't give you no names. You're just me. You're here for a cranial nerve exam, right? C&E, right? Right. Okay. And we've done 4 of these back rooms today. Okay. Yeah. So you're the 4th one. Okay. So, are you ready? Okay, I'm gonna put some gloves on because we're gonna have to touch your face. Okay. Turn off that cell phone. You cannot make no private calls because this is not this is not sanctioned, so you can't. This is under the table. And the less you know about me, the better you will be. That's why you come in blind. You come in blindfolded, and you leave blindfolded. Yeah, that's the way it's gonna work. Okay, can you hear that sound? Okay. Alright, we gotta take a temperature here. Open that mouth. Okay. Your temperature is normal. Alright, I'm gonna move your head back and forth. Hold on a second. Let's see if we can do this here. Okay. Any pain in your neck? No? Okay. I'm not gonna move. I was gonna tilt your head up and down, but I'm not gonna bother with it. Okay. I have your body. Okay, that's right. I'm gonna rough you up a bit. Okay. I'm gonna go back and forth a little bit here. Yes, you can walk a little bit, and not really, because you're sitting down. So I don't know how you're gonna walk. Yes, you can wobble the chair all you want. I just want to make sure. Okay, I'm gonna. Whoops, what happened here? All right, I gotta make sure you can. Okay, stand on one foot, or tilt the chair as best as you can. Okay, let me turn. Tilt the chair as best as you can. You're not tied up or anything. You just can't. You're not allowed to move because we don't want you opening up your big mouth, even though you're paid. We don't want you to say a word about this. Okay. Smile. Okay. Frown. Any pain there? Raise your head brow that way. Okay. Okay, blink and check your eyes. Okay, I need you to look up. Now, I need you to move your head like this. Move your head like this. Your head only. Up, down. Any pain? No pain? Okay. Can you see this? What color is that? Okay. How about now? What color do you see? You see green. And now you see what? Blue? Okay. Can you hear this? Alright. Can you feel this? And what color is this? Green? Okay. What color is this? You feel that? Okay. Can you feel this? Okay. Okay. Testing your reflexes. Below the knee, above the knee, below the knee, above the knee. How about your back? You feel that on your back? You feel this on the back of your neck? You feel this? Feel this on your face? Okay. Did you see distortion in my face? Okay. All right. This is sharp, dull. Can you feel that? Sharp, dull. Put this back on here for a second here. Okay, you can't see me, right? You see me, but I look distorted. You see yellow light. You feel this in your face? This is sensual test. Not sensual. Sensitive. Yeah, let's forget about what it's called. Do you feel that? Does it feel rough, soft? Okay. What colors are these? Alright. Can you feel that? Can you hear this? hear that? And what flavor is this? You hear that sound? Okay. Can you hear that? You see it? Do you see it? You can see like a spectrum of colors. Do you see that? What colors do you see? See blue, green, red, maybe even yellow. RGB colors. And you see anything else in there? Okay. Okay. Hold out your hands like so. You're shaky. That means you have some nervous condition. Hold out your hands. Hold out your hands. That means you touch your nose. Touch your ear. Touch your opposite ear. Touch your ear. Touch your opposite ear. Pull in your ear. Pull in your ear. Okay. Touch your forehead. Touch your forehead. Touch your face. Touch your face. Raise your hands like this. Okay. Push back your hands. Push back your hands. Push. Clap. Clap. Pop your face. Smile. Again. Up. So get your tongue out. Again. Okay. On your fingers. Now. Okay. Scan you. One, two, three. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. Let's see. Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. A, B, C, D, E, F, G. E, B, C, E, F, G. You heard that? You feel this? Okay. You see this? What color is this? What was that? What color is this? You see this color? What color is this? What color is this? This is multicolor. It's white. What color is that? What color is this? Okay, what is that? Okay. Okay. Okay, how many times do you see the green? 20, 30, 10. Okay, you got it at 10? Okay. How many now? How many times does it flash? Okay. This is super duper fast, super duper quick. Can you see it? The two colors together. Great. Do it. Okay. You hear that sound? It's coming from here. Tell me when you can't hear it. No, you can't hear it. Tell me when you can hear it. Okay. I'll put it on this side. Can you hear it? Tell me when you can't hear it no more. Okay, you can't hear it. Okay. Whew. Give me a second here. I need you to smell this. What does it smell like? Okay, that's good enough. Okay, your exam is done. Okay? No questions. No, you don't see me again. Unless you pay for it. Cash. No checks, no credit cards, no nothing like that. Yeah, we don't do the big fun stuff. No, we don't do it. You don't know what's up. You don't know what's about, and we're not gonna get involved with it. All right. I gotta let you go.